Despite overspending at a rate of $130 million a month, Health New Zealand says it doesn't need more money. Yesterday, the Health Minister sacked the Central Health Body's board over an estimated deficit of $1.4 billion. But as Zane Small reports, the government-appointed commissioner is blaming bureaucratic bloat.
It was announced by Labour in 2021.
Health NZ will replace the existing 20 district health boards to become our first truly national public health service.
But 3 years on, Health New Zealand, or Te Whatu Ora, is overspending at a rate of more than $100 million a month. Information revealed yesterday by the Health Minister Shane Reti as he announced that the board had been sacked.
It is not a decision I have taken lightly, but nothing matters more to me as Minister than the system delivering better outcomes for the health of all New Zealanders.
Former Te Whatu Ora Chair Lester Levi has been appointed as a commissioner, tasked with finding $1.4 billion in savings.
Health New Zealand Te Whatu Ora is a big organisation, and in my view it is quite a bloated, bureaucratic organisation.
The government earmarked more than $16 billion in health spending over the next 3 years. Labour says it's not enough.
Every day I get emails from frontline workers saying that vacancies they desperately need filled are going unfilled. People are not being able to have their maternity leave filled. Services that are desperately stretched can't get the doctors and nurses they need.
On top of the enormous challenge of merging 20 district health boards, Te Whatu Ora has been addressing workforce shortages, meeting the demands of a growing population and updating ageing IT infrastructure. And yet the health body says it does not need more funding.
We don't need more money, we just need to spend the money that we've got more wisely.
Chief Executive Margie Apa noted that Te Whatu Ora's finances were affected by big ticket items, like the historic pay equity settlement for nurses.
If it had not been for that transaction, we would have been much closer to break even.
She's hoping to create more efficiency by giving regions control over their services.
Putting in place regional deputy chief executives.
But former Te Whatu Ora Chair Rob Campbell isn't filled with confidence.
You miss your budget by the amount they say they're missing it by. That can be lax spending, but it can also be you just got your budget wrong.
A budget that's expected to cater for a growing and ageing population.
Well, Zane joins us now. Kia ora. So what is the plan to meet those savings?
Well, Sam, we're talking about a $28 billion organisation with nearly 90,000 people. It's massive. The Health Minister has talked about cutting back on back office bureaucracy, and he's talked about up to 3,000 roles. But it's not clear if that figure includes the 1,600 roles that were slated for disestablishment as part of the merger. Now, the Commissioner said today that he'll have more to say in the coming weeks about exactly how Te Whatu Ora will meet its financial savings goals, but he did promise that it won't include cuts to clinical.
OK, that's good to hear, Zane. Thanks for that update.